Hi, I'm here to talk about a paper entitled Redundancy Gain in Simple Reaction Time Following Partial and Complete Callosum, authored by Michael C. Corballis, Paul M. Corballis, and Mara Fabri. I actually got the opportunity to interview with Dr. Paul M. Corballis because he's a professor here at Georgia Tech, and I'd just like to say that it was a great interview and it's very obvious that he's excited about his work. He primarily works with split-brained patients and visual stimuli, and in this paper he tests the split-brain patients with visual stimuli regarding reaction times. He either presents them singly in one or the other visual field or simultaneously in both visual fields to test the reaction time. Now, the theory behind, or rather what he wants to test, is in a concept called redundancy gain, where essentially your reaction time is sped up more so than what is predicted in a simple race model, and he's asking why. The split-brain patients show a much greater reduced reaction time than predicted by the race model than normal patients, and one of the theories behind this is that there is an inhibitory function in the corpus callosum that is sectioned during either complete or partial callosum. The paper states that they believe that it is the part of the posterior corpus callosum that has this inhibitory function. So part of their subjects, or rather, they have subjects with anterior callosotomies as well as partial callosotomies. In the procedure, the stimuli were presented in 4 blocks of 99 different trials. Each block there were 30 trials where the discs were presented to the left visual field, 30 of which were presented to the right visual field, 30 of which were presented simultaneously to both visual fields, and the 9 CATS trials in which no stimulus was presented. The only deviation in the procedure between the split-brained patients and the normal patients was that the split-brained patients performed all the trials with the right hand prior to the left hand. This was done because there was a noticeable difficulty in starting with the left hand unless they had significantly practiced with the right hand. The results from this are pretty interesting. It shows that patients with anterior section of the corpus callosum showed little or no violation of the race model with bilateral input, meaning that most likely the posterior part of the corpus callosum has the inhibitory effect. This can be seen in that the patient with the posterior callosotomy clearly exceeded the race model when testing with bilateral visual stimuli, especially with the left hand. One possible discrepancy for this is that there might be different callosal routes that can mediate rapid transfer, so it might not just be in the posterior corpus callosum that has this effect. With these results, it's important to note that even though there's an enhanced reaction time in split-brained patient, this still did not speed up their reaction time compared to the normal patients. The paper states that the idea that bilateral stimulation has a greater summation effect in the split brain than in the normal brain is not strongly supported, since in no case did any of the split-brained patients respond more quickly to bilateral stimuli than the normal mean. I think the most interesting thing about this paper is that it proposes a new idea, that the corpus callosum has an inhibitory function rather than the general known function that it serves as the primary means of interhemispheric communication. This doesn't mean that communication through the corpus callosum is no longer its primary function, but that there are underlying mechanisms that we still don't know about in this section of the brain and even more so other sections of the brain. Personally, I'm looking forward to following this series of research and seeing what impact that the results of this research may provide in the future.